My name is Blanca Rodriguez. I work in United Community Center in the Health Research Department. We're collaborating with MCW to do the TO program.
Hello, my name is Sally. I work at the Medical College of Wisconsin. We know that the Latino community has a higher susceptibility to diabetes, and that's one of the biggest things, but we're still looking at different kinds of eye diseases. And we bring in these participants. They come to the United Community Center, and we make it easier for them because we have the machine here instead of them having to make a trip to the hospital or the clinic where it's harder for them to make time, and so it's easier for them to come here.
I'm then charged to bring people from the community to be involved with to do screenings, to be involved with the program. We have staff from United Community Center, or for parents from the school, and many other people who wants to participate in this program.
We first bring them in and they fill out a consent form where we explain everything about the project and what's going on, and then after they fill out a questionnaire where they fill in their information, their date of birth, if they speak English or not, their level of education, if they know anything about diabetes, and if they know that could lead to blindness, things like that that we can use in our paper and for our research. We bring them into this area where we sit them down and we use this machine to take photos of their retina, which is the backside of their eye, where the doctor can see a lot of the diseases and pathology there in the retina. This concept is really interesting because we're using a concept called telemedicine. This is pretty new, and it's something that we're still trying to see if participants are comfortable with using this concept. What it is we use technology as a medium and way to make things easier and efficient for these patients and participants. So basically, we don't have the doctor inside the room. It's just me or a different person who's part of the research team who just takes the photos, who's trained to use the Optos imaging machine to take photos, and then the images are sent to the doctor through the computer, and she can review it on the computer or on her tablet. And then we made this app where she can just basically transfer the results and send them over to the United Community Center, where the research team at the United Community Center sends the results to the participants through mail. And if it's urgent, we make sure to call them and send the mail fairly quickly. But yes, it takes a few weeks for the doctor to review them and then for the results to be sent to the participants. And so overall, it's just an easy and more efficient way of checking on these participants who could be more susceptible to eye diseases, and it's easier for them to come in and check their eyes. We'll be sending these images through the computer for her to see. So It's all about telemedicine and her not being here and how you feel about that. We're making it more easier for you because we're coming to your workplace. And you can just stop by whenever you have time for like 15 minutes and leave, So it's just that kind of concept. So
Nice.
Do you have any questions or?
No, I think that's cool.
Okay, cool.
Nice. Thank you.